stretcher. Like, remember how he puts all the equipment on a stretcher back there, and the sharps containers will be at each of the bedside. What's going to be here is this and this. And then you're going to open it up and you're going to see a whole bunch of medications are in there. And these are from the last testing session, so I haven't really cleaned up the boxes yet to get ready. So it says here, you're going to separate the sheets, and you're going to find a doctor's order, and you're going to find the MAR. This is the Medication Administration Record. And I'm going to say, who has a pen? I said, I'm going to say, that's good. Now, when you come to test, make sure you have a black pen. And you're going to, these are the orders here. And it has the diet, the IV orders, chest x-ray, and then you get to the medications, Carafate. Now, this one doesn't exactly, oh, it did. I happened to pick the box that went with the Elizabeth Hernandez, and Elizabeth Hernandez is the MAR. And I'm going to say, you're going to give 2 drugs. You're going to give, and I can pick anything. The first one, Versed here, gives you the dosage, the IM, every 2 hours PRN, Lasix, 25 milligrams IM BID, and the generic name is up here in the upper right-hand corner. Here's the PPD, which was already given. We're going to give Digoxin IM. Here's Novolin, Clafurin, and then Cataflam. So if I say, okay, I want you to give the Cataflam and the Z-Track Clafurin. Okay, so you're going to come over here and look for the Cataflam, which I don't have here. It's going to be a pill, sort of like this. Okay, and I'll have the boxes all fixed up so you won't have to search too hard for the medications. And it'll have a label on it, and that would be, if this one, say this was 25 milligram per cap, or say 50 milligrams per capsule, you're going to have 2. And you can do your math on this side of the paper. You have to do I'll have you do X tablets, and the doctor's order is for 100 milligrams, and it's 50 milligrams per capsule. So you need to have 2 caps. So you have the math for 1, and then we're going to go to the Clafurin. So here's the Clafurin. Here it is right here. And the Clafurin is 1 gram, and it comes 500 milligrams per 1 milliliter. So you're going to find X milliliters equals 1 gram, and 1 gram we have 1,000 milligrams, and the Clafurin label is 500 milligrams per 1 ml. So we need 2 mLs. That's what you're going to draw. Those 2 things only, nothing else here. You're going to sign your name, and your name is I am student SNMDC. That's your legal signature, and then your initials. Now, when you chart your initials, this says we're getting these 2 drugs, which is at 0600, which is on the 3rd shift. It's during the night shift, so 0600 is going to be charted. When we give these 2 drugs at the bedside, you're going to carry, we have little trays over there, little brown trays. You're going to have I'm going to watch you draw this, the 2 milliliters up, no air, no contamination of the syringe. You're going to swoop and scoop recap. We put this back in here, and then you have your little tray with your pill cup and your 2 capsules in it and your syringe, and now we go, knock, knock, knock. My name is so-and-so. I'm here. I've checked the doctor's order. I have 2 medications to give you, 1 injection, which is a Z-Track, and a pill. And then you're going to say, I'm going to provide for privacy, provide for safety. I'm going to sit the head of the bed up and give the patient a glass of water to drink the 2 pills. You're going to have the head of bed high for that. Then we have to give the injection. So I'm going to say, okay, proceed with the injection. Now you don your gloves. You don your gloves before you give them the pill. Right when you come in and set everything on the table, you're going to be actually doing everything on the table. So now you're going to have your little gloves there. After you draw everything up without gloves, you put your gloves on. Now you can say your overriders. And then you're going to do the Z-Track, and the Z-Track is always in the ventrogluteal site. Once you give the medication, you slash through it with black ink, and you put your initial, IS, I am student. that means you've given it. If you ever see this on an MAR, where they circled it, it means they didn't give it for some reason. And sometimes you'll see the nurse write refused. The patient didn't want it for whatever reason. Now, see how they slash this and they put MCF? We can look at this initial and go down here, and that was Mary C. France, RN. Okay, so your legal signature has to have SNMDC. If you went to FIU, it would be SNFIU, SNBU for Barry University. Okay, so that's how we know if this chart worked, if this signature sheet should go to court, they can identify where you're a student nurse and where you're from. So you need to conserve your, in other words, try to write kind of small. Some of you have really big handwriting. Okay? That's how I would write my name. So that's how you're going to do these medications. Now, if you had a medication that had 4 different times, you don't chart anything here because this is just the schedule of the time. Okay, that just tells you when to give the med. It's charted in the shift boxes, and this is for 1 day. So, okay, they gave this at 2 p.m. because it was charted on the day shift. Notice that they're on a standard clock. They're not using, but this is military time. So normally you have one or the other. 1800 is 6 o'clock at night.
And this 2 in the morning is right.
That's supposed to be 2 in the morning, but it's charted under the first shift, which is days. If it was 2 in the morning, it would have been on the night shift. So that's a good point. This is 6 p.m., so 6 p.m. would be charted on the second shift given. Now, that's why you can't get real big like that because you have 2 doses that have to be charted. So if you had 4 doses, you're going to see 4 times and 4 initials. So you kind of have to make things kind of small. So once you give the med and you've signed that you're going to document and you're going to complete the skill and you're going to wash your hands, that completes it. So it's one injection.
Can you give the meds?
It's one injection. No, I'm going to have you guys start giving.
Do the first example, please, so I can record.
I'm going to have you do it.
Yes, sir, please.
I'll have Alex do it. Okay, Alex. Supposing we had the 2 mLs of Clafuran. Go ahead and wipe that.
You don't need gloves for this part.
Not for the drawing up part of it. Pull straight off, that's it. Put your air in you got to put air in there. 2 mLs. Don't touch in here.
Oh, gosh.
There you go. It's easier if you put it down like this and hold it. That's it. And go like that. And now turn it over. Push in the air. If you hold it straight up, you won't get air. Like you got a little bit of air already. So pull it down to the 2.5. Okay. And now get your air out. So you need to do that, you need to tilt it towards you and tap it. Okay. Tap it just a little bit over the air bubble itself. Now push it up. You have another air bubble down here.
Professor, I'm sorry, this may seem like a ridiculous question, but what is the purpose of injecting the air?
When you're injecting, no, that's a good question. If you were to take a vial and just pull out fluid and pull out fluid, and you're going to create a vacuum in there. So you're putting in the amount that you're going to take out to equalize it. And the same idea is if you put 10 milliliters of air out in here and only take out 2 milliliters of fluid, you're going to create a compression in there. You're going to create a lot of fluid, a lot of air. And so the next nurse that puts in a syringe, it'll push the barrel out. So, and if you're just pulling and pulling and pulling out, the next time you try to draw, it makes real difficult. So what goes in must come out. Okay. Now, there's medication that just dripped down the needle. So in that case, you would verbalize to me that I could change the needle, because most of these medications, when you look at the labels that are in your math book, you'll see it has the pH on there, and the pH is like 5. So it's kind of acidic. So you don't want a medication-coated thing. So you can just change your needle out if you needed to. You have an extra needle when you come to test. If you contaminate it, you just need to tell me that you did. So now we'll pretend that it's a clean needle. Go ahead, and the reason you don't want to come out to get your air out of the vial is because every time you go back into the vial, you dull that little tip, and you might get a burr, which is the tip is twist. And think about how that would feel going into tissues. Okay, swoop and scoop. No, swoop and scoop. That's it. Okay, and so then you're going to get a little brown tray from over there. Do you see the brown trays? Get one of those. You're going to get that when you start testing. So you can't normally leave the bedside and leave your medications.
Professor, you said don't recap the needle, even if it's
You
on there.
recap the needle after you draw it. You never recap it when it's been in a person's body. Okay, and so we're going to pretend we're also going to have our... get it, Janet, get a little med cup there. Okay, place it right there. We've got that. We've got this. You're going to get your gloves and get a set of gloves there.
See these trays at the nursing homes where they come already prepared.
Sometimes if you're right outside the room, they don't even bother using them. So then you're going to come in and say, hello, my name is Alex. I'm here to take care of you today. I checked the doctor's order. I have a medication, an oral medication, and an injection to give you.
Which one you
And
prefer to have first?
huh?
Which one would you prefer
Usually
to have
you
first?
go
the oral.
oral. Because, that depends. If they're laying down and it's a big production to get them sitting up, it might be easier to give the injection first. Okay, so you're going to verbalize, I'm going to put the head of the bed up, okay, and I'm going to give patient, Selvin will have water in a pitcher there. I'm going to have some water, and I'm going to assist the patient, and then you take your medication. Now, normally you check the medication 3 times. Once when you take it out of the Pyxis machine, you check it to see if that's the proper pill. When you're getting ready to prepare it, you check one more time. And then when you're in the room, right before you give it to the patient, you're checking a 3rd time. Okay, this is the right drug. I have claflin. I've done my math properly. And remember on the last test that said when do medication errors occur mostly is when you're implementing, when you're giving them. So it's all these steps are when people are stopping you when you're trying to get all of this together. So now we're ready to go in there. I've checked my medications the 3rd time. I'm ready to go. Now I'm going to just put this back in the container because we can't give, these mannequins can't have any fluid. The little those injector pads there. Selvin, we could put fluid in the injector pads?
Yeah.
It's just these that we can't.
No.
And also the little arm thing. That one, right? No fluid in this one, right?
No fluid in that one.
Okay. So the only one you can actually inject fluid into is that one. So get one of those because the nice thing why I want you to look at that is because, put it right here, is because this one, it really feels like a human tissue. So I put 2, like I have my medication in there. And so we're going to do the ventral site on there, but I want you to feel what it feels like to aspirate. And this little injector pad feels like a real human and when you're trying to aspirate. So you're going to take your alcohol and you're going to, let me get it a little closer to you. Going to wipe it. And usually put this right next to where you're going to inject, because once you're done with the injection, you want to move it back over and put some direct pressure on, so you don't want to lose it in the bed.
Well, you're not supposed to rub after you give an injection.
You just
Apply pressure.
okay, hold it like a pencil. Okay, like a pencil, down closer
just big.
You just put a little pressure, okay? Because you want to seal the hole.
It's a huge one, right?
Okay, you want to hold it down here a little bit more. Hold it down more, like a pencil. Now you're going to jab it. This isn't this was supposed to be Z-Track. We'll do Z-Track in a minute, but I just want you to do a regular IM for now. So jab it 90 degrees, straight in, aspirate, and it feels like a tugging sensation, right?
Yeah, it feels like it's putting.
Like a pulling. See how the plunger goes back in. Okay, did you see that? Here, I'm going to aspirate. You see it moving back? That's what it does in a human's tissues because this has a gel in it. So we're sucking the gel in here. So aspiration is not pulling this out. It's just a tugging sensation, just a slight sensation that you get. Okay, so now go ahead. You had one hand here. You can aspirate with this one. Go through the aspiration part. Inject. Okay. Just feel that and then come out. Okay, and then take this. Nope.
Oh, okay. Sorry.
Okay, take this and place it over the hole. Just a little pressure. And then that goes into sharp container, which will be close to the bedside. So you remember that has to happen. You don't want to recap. That's an immediate fail if you cap.
Yeah, because if
Professor.
you recap it, it's gonna.
I have a question.
Yeah, that's
Why
what
do you put the alcohol pad, not the something the
gauze or
yeah, because this has alcohol. It will burn the patients more.
It's
sand
just
that-
traditionally what we use. You have to chart, like at Health South, every little square of gauze, you have to charge the patient for it. These are not charged. And normally you don't get a lot of blood out there, and it doesn't burn that bad. You've had injections before, right?
Yes.
And they use alcohol on it. So it's not
One
like
time they did to me and it hurt.
with the alcohol.
Yeah.
With the alcohol. Okay, now let's pretend we're going back to do what the doctor's order was, which was Z-Track. So I'm going to have Alex, I'm going to hold this for you, Alex. We're going to find the site, and usually what I do is I hold the mannequin for you. So first of all, Alex, with your thumb, two thumbs together, feel for the bone. Okay, you feel it right there, and when you guys play with it, there's a big ball in there. And so, are you right-handed or left? Okay, this is the patient's right leg. To measure it, we have to use his left hand, however. So once he finds that ball, he's going to put it in the palm of his hand, and then he's going to twist it. This little bump right here is where the index finger goes on here. He's going to spread his fingers like that, and we're going to go for 1 inch above the crook of his finger, and you're going to put your alcohol here to seal your spot. Take your hand away. Just place it there. And take your hand away. Okay, go get your syringe. Why don't you come around here so he can give his injection, little girl? Hello?
Excuse me.
Okay.
Well, I just pretend I dried already.
Yeah, we're going to pretend. Remember, these mannequins can't take any fluid. Now, this is Z-Track. So you're right-handed. I want you to get the syringe in your hand like this. Okay? And then use your... You got rigor mortis here. Okay, pull. We got to pull this away. You're going to pull that. Now, this is a one-handed technique. So go straight in. Okay, dart it. You did this and then pushed.
Okay.
Okay? And then... No, you have to aspirate. That's a fail if you don't aspirate. So slide your hand up like this and aspirate. That's it. Okay, and inject. We're going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And slide this hand back down to where my fingers are. And not that far. You never touch this way down. And pull straight up. And release at the same time. When you release at the same time, everything goes, go ahead and throw that in there. Everything goes over, creates the Z-Track. Now, on Z-Track, what we didn't do is we didn't change the needle after we drew up the medication. That's another part of that skill, is we change to a fresh needle after we draw up.
And what about the little air lock?
You can put an airlock in it, point to, I think they're going to get rid of that, but that's not really a critical element. but 0.2 to 0.4. So 0.2 would be 2 lines after the 2, so it'd be like 2.2. What the airlock does is it clears the injection.
Professor, why do you use each aspirate?
You always aspirate to make sure you're not in a blood vessel.
Oh.
Is that for all the injections or just
Only
the
IMs.
IMs?
Because those are very vascular. The fat is not very vascular.
Subcutaneous.
If you look at a fat looks like that blobby fat that's on chicken. I always trim that off with a scissor.
Yellow.
That yellow stuff. It has very tiny little vessels that are in it. That's what the dog's in the lab. Anyway, that's how you do Z-Track. Now, let's have you do a PPD.
Yes.
Just a question. Is it Z-Track? Says 180
Mm-hmm.
motion. So once you put it in, do you leave the needle hanging? You can't.
No, you can't leave the needle hanging. So his question is, can you let go of it?
No, I'm not.
It's-
Because you told me we had to switch.
No, you do it like this. Give me a 2 cc syringe. We threw that one away.
So with the Z-Track, you're like moving the skin, doing the injection,
And then
letting the skin come back.
the subcutaneous and everything slides back over. Okay. All right. Okay, someone put the safety on that so it's no good anymore. You see that? This is the safety tip. You can change your needle out anytime you want to. Okay. We've got our 2 cc's and our 2 airlock. Okay? So I got my gloves on. I feel for this. This is the patient's right leg. This is my left hand. I find the head of the femur. I go back like this and right like that. Okay? I'm going to set this aside. I'm going to draw the skin over. His question was, when you go like this, what if you go like that? You can't do that. You have to come up, slide your hand up like this into position. Aspirate, inject, count 10 seconds, out and release. It's the only one-handed injection. Everything else you can do. You could use the same site for just a regular IM. You're going to aspirate, inject, and come out. That's two-handed. Okay. The problem with one-handed for things like PPD and sub-Q is that the farther back this is, the harder it is to do. Say if you had like a 0.9 injection, okay, and you're going to do sub-Q, okay, and sub-Q, remember you can go 90, this is a short needle, so I can go 90, or I can go sideways 45 degrees. So notice how far back you have to get this. It's easier just to go, we're not even aspirating, but if we use this for, say if we use this for IM for here, okay, and of course you can't use that length needle, it has to be 1 milliliter. And if you're going to aspirate, if you're giving the flu shot, which is 1 milliliter,
I just take the flu shot.
right, it's better to just use 2 hands to aspirate when you're using this small one. If you're doing sub-Q, we're not aspirating at all, you just inject and come out, you're done.
Professor, which one is the PPD? Is the one you did there?
He's going to, no,
Oh.
he's going to do one right here. Okay. Here, a PPD is usually 0.1 milliliters. Let me see what it says here. 0.1 milliliters. Okay. So when you do PPD, you're going to wipe it in a circular motion. You wait till it dries. And since your knuckle is going to hit the mannequin, you do it this way. Now, the bevel has to be up, and the bevel is on the side. Okay, stop, inject. You're making a wheel, and then back out. And then sometimes you circle, and that would go right in the sharps container. That's good. Did good
You
job.
would circle
Bevel
one?
up,
Bevel up so that the
Just
medication,
into it.
right.
just enough to,
You don't want to try to thread the whole thing through.
Another question I wanted to ask you.
Okay, do a sub-Q.
Doing the drawing it out, we always draw it out with a thicker needle. So we would change the needle and doing.
You can't do that, not with insulin. Insulin is a permanent needle.
No, I'm talking about for say for Z-Trax or.
For Z-Track, you're going to switch the needles. Okay, let me have you.
What? You don't change insulin needle?
You can't.
They're permanent. They don't change it.
It's permanently on there.
Oh.
Okay, let's just say we're going to do 20 units of NPH. So, go ahead and inject the air. Don't put your finger on there. No, don't. Never put your finger on the plunger when you're getting ready to put it in there. Remember, like a pencil. Okay, turn it over and get your 20 units out. Now, an NPH is cloudy. So look where all the cloudy stuff is. So an NPH, you have to shake it to get it cloudy before you draw it. Or otherwise the medication settles out. Now get your 20 units. And turn it over so you can see the 20.
what's an NPH?
Long-acting insulin. There's a short-acting insulin which is clear. So we also have to do a clear to cloudy draw. I'll have Alex do that in a second. Go farther down than your 20. Let me see what you're doing. Okay, let go. Let go. Okay. All right, you have air here. All right. You have to hit it hard, right over the air bubble.
I'm about to like break it.
No, you're not. The only thing is doing this and wobbling this around is you can bend the needle. And then what if you bend the needle?
Yeah, so
You have to put it in. You have to put it into the patient sideways.
No.
You get a new insulin syringe. Okay, see the needle is bent. Okay, and that's 24 units. Each line after 20.
Oh, I thought you already had put it.
No, I gave it back to you thinking you would do that. Okay, so what I'm going to do now is I want you to go get your syringes and everybody start to, let's practice drawing, okay? And we're not going to use the test box.
Did we do the example of everything, Professor?
We did intradermal, sub-Q, and IM.
That's it? That's all we need, Professor.
Go ahead and put it in there.
Yeah, that's all we need?
That's it.
Okay, stop.
Alex, do you need a hand?